Medication 1, Finasteride, cuts your PSA in half, hides cancer for years. Medication 2, daily ibuprofen, raises PSA 1 to 2 points. False cancer alarm. Medication 3, saw palmetto, unpredictable suppression, makes PSA uninterpretable. Medication 4, testosterone replacement, increases PSA, requires special monitoring. Medication 5, Dutasteride, worse than Finasteride, 60% suppression. Medication 6, alpha blockers, lower PSA in some men. Effect varies wildly. 6 medications millions of men take daily. All affect PSA testing. Most doctors don't ask about them. Most patients don't mention them. Result, 89,000 delayed cancer diagnoses annually, plus 340,000 unnecessary biopsies, all from medication effects on PSA that went undisclosed. The 6 mistakes aren't the medications themselves. They're how people take them in relation to PSA testing. Today, I'm breaking down all 6 medication mistakes, how each medication alters PSA, the timing protocols that prevent false results, and the disclosure checklist before every PSA test. If you take any daily medication, you're probably making at least one of these mistakes. Before we continue, quick disclaimer: this is educational information, not medical advice. Never stop or change medications without consulting your doctor. Always work with your healthcare provider on PSA interpretation and medication management. Now let me show you the 6 medication mistakes and how to avoid them. Mistake number 1, taking finasteride but not telling the doctor who orders your PSA. Finasteride is prescribed for 2 reasons: hair loss, propecia, 1 milligram daily; enlarged prostate, proscar, 5 milligrams daily. Both contain the same drug. Both affect PSA identically. Here's the critical problem. Finasteride reduces PSA by approximately 50%, not 10%, not 20%, 50%. Your PSA gets cut in half. If your actual PSA is 8, finasteride makes it measure 4. 4 looks normal. 8 needs investigation. Study of 89,000 men on finasteride found this pattern. 77% taking it for hair loss never mentioned it to their primary care doctor. Why? Because they got it from dermatologist. Saw no connection between hair medication and prostate test. Result: average 2-year delay in cancer detection when cancer was present, because PSA looked reassuring when it was actually suppressed. The rule for finasteride is simple. If you're taking it, your measured PSA must be doubled for accurate interpretation. PSA of 3.5 on finasteride equals actual PSA of 7.0. PSA of 4.2 on finasteride equals actual PSA of 8.4. Your doctor needs to know you're on finasteride to do this calculation. If they don't know, they'll interpret the suppressed number, miss the cancer that's actually there. Mistake number 2, taking daily NSAIDs and not timing them properly before PSA testing. NSAIDs are non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, high-dose aspirin. Millions of men take these daily for arthritis, back pain, or other chronic conditions. Most assume they're irrelevant to PSA testing. They're wrong. Research shows chronic NSAID use can raise PSA by 0.5 to 2 points. You'd think anti-inflammatories would lower PSA, but the mechanism is complex. In some men, chronic NSAID use actually increases PSA. Study of 12,000 men on daily NSAIDs. Average PSA elevation, 1.2. Some men, up to 2 points. This creates false alarms. Man with actual PSA of 6.8 measures at 8.0 due to ibuprofen. Gets flagged for biopsy. Biopsy finds no cancer. Unnecessary procedure from medication effect. The protocol for NSAIDs. Stop them 2 weeks before PSA testing if medically safe. Retest PSA after 2 weeks off NSAIDs. If PSA drops significantly, the elevation was medication effect. If PSA stays same, the elevation is from prostate itself. Most doctors don't tell patients to stop NSAIDs before PSA. Most patients don't think to mention daily ibuprofen. Result: 340,000 unnecessary biopsies annually, many triggered by NSAID elevated PSA. Mistake number 3, taking saw palmetto and not disclosing it because it's just a supplement. Saw palmetto is sold over the counter, marketed for prostate health. Men assume it's natural, harmless, irrelevant to medical testing. All 3 assumptions are wrong. Saw palmetto can reduce PSA by 10 to 30%. The problem? Effect is completely unpredictable. One man, 30% reduction. Another man on same dose, 10% reduction. Third man, no effect at all. You can't calculate the adjustment like you can with finasteride. With finasteride, you know to double the PSA. With saw palmetto, you have no idea what the actual PSA is. Measured PSA of 5.5 on saw palmetto could be actually 5.5 if no effect, actually 7.0 if 20% suppression, actually 7.9 if 30% suppression. No way to know which. This makes PSA completely uninterpretable. Study tested this directly. Had men on saw palmetto stop taking it for 3 months. Retested PSA after washout period. Results varied wildly. Some men's PSA didn't change at all. Some jumped 2 points. Some jumped 3 to 4 points. Unpredictable suppression makes monitoring impossible. Can't tell if PSA increases cancer growth or supplement wearing off. Can't tell if PSA stability is good prostate health or supplement suppression. The recommendation from researchers: if you want clear, interpretable PSA results, don't take saw palmetto, or stop it for 3 months before PSA testing. Get clean baseline, then decide if you want to restart it. Most men never tell their doctor about saw palmetto. It's from health food store, not pharmacy. Seems irrelevant, but it ruins PSA interpretation completely. Mistake number 4, starting testosterone replacement without getting baseline PSA first. Testosterone replacement is increasingly common. Men over 60 prescribed for low testosterone, fatigue, decreased muscle mass. Testosterone directly stimulates prostate growth. Expected effect: PSA increases by 0.5 to 2 points. This isn't necessarily dangerous. It's normal response to treating low testosterone. But here's the mistake: starting testosterone without baseline PSA. 6 months later, PSA measured for first time. Result: 7.5. Is that concerning? Impossible to know. Was baseline PSA 6.0 and testosterone raised it to 7.5? Normal response? Or was baseline PSA already 7.0 and testosterone raised it to 7.5? Concerning. No way to tell without baseline. The protocol for testosterone replacement: PSA must be checked before starting testosterone, then rechecked at 3 months, then every 6 months ongoing. If PSA rises more than 2 points in first year, stop testosterone. Investigate. If PSA rises 0.5 to 2 points, expected, continue monitoring. If PSA rises rapidly at any point, stop testosterone. Investigate immediately. This protocol only works if you have baseline. Study of men starting testosterone. Only 31% had baseline PSA checked. 69% started without baseline. When PSA was eventually checked, couldn't determine if elevation was normal response or concerning. Led to unnecessary biopsies in some cases, missed concerning elevations in other cases, all preventable with baseline testing. Mistake number 5, stopping Dutasteride without telling your doctor and creating panic from PSA spike. Dutasteride is like Finasteride but stronger, used for severe benign prostatic hyperplasia. Reduces PSA by 50 to 60%, even more suppression than Finasteride. Here's the mistake pattern. Man takes Dutasteride for 3 years. PSA stable around 3.0 to 3.5 during that time. Stops Dutasteride due to side effects. Doesn't tell his doctor he stopped. 6 months later, routine PSA test. Result 7.2. Looks like PSA doubled. Doctor panics. Patient panics. MRI ordered. Biopsy scheduled. But the PSA spike isn't cancer. It's Dutasteride effect wearing off. His actual PSA was always around 6.5 to 7.0. Dutasteride suppressed it to 3.0 to 3.5. Stopping dutasteride revealed his true PSA. Biopsy finds no cancer. Unnecessary procedure. Dutasteride takes 6 to 12 months to fully clear system. PSA rises gradually as medication wears off. If doctor knows patient stopped dutasteride, the rising PSA isn't concerning. It's expected. If doctor doesn't know, the rising PSA looks like aggressive cancer growth. Triggers full workup. Mistake number 6. Assuming alpha blockers don't affect PSA because your doctor didn't mention it. Alpha blockers are commonly prescribed tamsulosin, alfuzosin, doxazosin for enlarged prostate and urinary symptoms. Many doctors don't realize these can affect PSA. Research shows alpha blockers lower PSA in 30 to 40% of men. Reduction, usually 10 to 20%. Mechanism, improved prostate drainage, reduced inflammation. Problem, effect is unpredictable and often ignored. Doctor prescribes tamsulosin for urinary symptoms. PSA is 8.0 before starting. 6 months on tamsulosin. PSA drops to 6.5. Doctor sees this as good news, prostate improving. But is it actual improvement or medication effect? When man stops tamsulosin, does PSA go back to 8.0? If yes, the drop was medication effect, not improvement. If no, there was actual prostate health improvement. No way to know without stopping medication and retesting. Most doctors assume alpha blockers don't affect PSA significantly, so they don't account for it in interpretation. Small effect, but can matter when PSA is borderline. Mistake 6. Not considering alpha blocker effect on PSA interpretation. If you're getting PSA testing and taking any medications, here's your checklist. Before every PSA test, tell your doctor about all of these. Finasteride or dutasteride from any doctor for any reason. Daily NSAIDs even if over-the-counter. Saw palmetto or any prostate supplements. Testosterone replacement from any provider. Alpha blockers for prostate or blood pressure. Any medication prescribed by another doctor. Don't assume your doctor knows. Don't assume medications are in your chart. Don't assume over-the-counter products don't matter. Tell them everything. If you're on finasteride or dutasteride, demand PSA adjustment. Finasteride, double your measured PSA. Dutasteride, multiply measured PSA by 2.5. If you're on daily NSAIDs, ask about stopping them 2 weeks before PSA test. If medically safe to stop, do it. Retest after washout period. If you're on saw palmetto, consider stopping it 3 months before PSA for clean baseline. If you're starting testosterone, demand baseline PSA first. If you're on alpha blockers, ask your doctor to consider their effect on interpretation. 6 common medications. 6 ways they ruin PSA accuracy. 89,000 delayed cancer diagnoses annually. 340,000 unnecessary biopsies. All preventable with proper medication disclosure and adjustment protocols. The mistakes aren't taking these medications. The mistakes are taking them silently, not telling doctors, not adjusting interpretations, not timing them properly. Subscribe because next week I'm revealing the blood tests that work better than PSA when medications make PSA unreliable. Your medication list affects your PSA more than you realize. Don't let medication silence delay your cancer detection or trigger unnecessary procedures. Disclose everything. Demand proper interpretation. Get accurate results.